Hey, we are going live and you got 2 for 1 today. We're talking stigma in functional neurologic disorders and most importantly, what we as healthcare professionals can do about it. And if we haven't met, my name is Julie Hirschberg. I'm a neurologic physical therapist and the owner and founder of Re+active Therapy and Wellness. And I get to have Lauren here.
Hi, I'm Lauren Keats. I'm a neuropsychologist at Re+active.
And we're squeezing ourselves together because it's cold in this room, but also so we can fit in this frame for this video. There's one area that we're super passionate about when it comes to FND, and that is the stigma that is attached to it as a diagnosis. And there's actually been like probably 3 or 4 recent articles, right?
Yeah.
This has come up a lot. And Lauren has a particular favorite that we'll chat about today. In fact, I'll share it with you here. So this article. So we're going to chat about this today. And by the way, I'll send the link in our newsletter today, which if you're not on that, join our newsletter. We send it out every week. You can join at reactiveeducation.com as a clinician or reactivept.com as a patient. But the article is a really lovely qualitative study, how stigma unfolds, I love how they use that word, unfolds, for patients with functional neurologic disorder. And this just came out this year. The group is out of the UK, and it's really based on the lived experience of people with FND. And there's so much that we can learn from this. So I'll include the full citation with the recording, and again, the link to the article in our newsletter if you're looking for that. But we want to talk about this. So let me stop sharing this, the citation there. And I want to start with just, why do we even care about this, Lauren? Like, I know both you and I have been kind of obsessed about it, but why is this important for us as healthcare professionals?
Yeah, so at Re+active, we see many people with functional neurologic disorder, and the grand majority of my experiences working with this population, I've really seen a lot of the themes that were pulled out in the paper as being a huge part of a person's quality of life and their emotional health. It's very common for us when we're talking with people with FND to have really arduous paths to diagnosis. For many people, it takes many, many years, or they've been misdiagnosed or being sent from provider to provider to provider, just having no clear answer. And that's really so stressful for the person, as you might be able to imagine. We also see many people that have reported just negative experiences with healthcare teams. Whether that's being overtly told symptoms are all in their head or that they should just stop, to like more like covert modes of like communicating. And we see that it's just a really odd experience. People with FND are treated so differently than people with other neurological conditions. And this experience is just so stressful. And so we see really stigma like all around people from the time of symptom onset, and even continues to well beyond a person's treatment. And it just being so difficult. And as a psychotherapist, just a really important piece to target is what I've learned. It's become very apparent to me through my experiences just how important it is to really take the time to understand a person's experience of having the symptoms, what it was like for them to get a diagnosis, how other people are treating them, how they perceive other people to view their symptoms. That's just playing such a large role in quality of life, and maybe even more of an impact of the motor symptoms themselves.
For sure. I was thinking, one of the things I love about a qualitative study is they have these quotes, direct quotes from patients, right? And I included one, I know her name is Grace. Let's see. Yeah, it was this one. That one? No, it's this one, I think, because I included this in our post today. And, if you're a person with F&D or you're a clinician who has worked with people, I would love to hear your comments here. Does this resonate? And this person was talking about their general practitioner and how upsetting it had been interacting with them, and how this is the quote, he did say, "Could you not walk in?" And I'm like, I can, but he made me feel like he was saying it was all in my head and I was making it up. And I was just sort of like, why would anybody make this up? And I know I think that a lot. And a lot of clinicians maybe inadvertently communicate this, or quite purposefully communicate this, that they leave the person really experiencing that they're making it up. And that was like a theme, right? That really went throughout. I think I always love to share the methods of a paper. They interviewed 15 people, and they kind of did it sequentially to where they found that there were no new themes coming out, I believe maybe after 9 folks. And so they kind of put together all of this data from these and included these really lovely quotes, by the way. So if you're a person with FND, I highly recommend this article because I think it kind of validates your experience that you're not alone. And I want to point out too here, hello, Ethnicity Gardens. My brain doctor alluded to that, but didn't directly say it. And that's actually a theme that comes up in here, right, Lauren? So also, you're not alone in that experience, which is such a weird experience for people. Like, why wouldn't somebody come out and describe a diagnosis, for example?
Yeah.
So let's talk about some of the themes that came up. So one of them that I shared was this kind of othering by the health system. And I know we have a graphic of this, and said I ignored her. Okay. And that was very helpful for you to ignore, I think. And I will walk 500 miles says, I experienced this too before a diagnosis, junior doctor. Yeah. And someone else says, good on you, Ethnicity Gardens. This is hard to ignore, right? To me, that says a lot about you, and that you say, you know what? No, this is very real. I have no control of it. And, either I'm going to seek another opinion or I'm going to get what I need, which is treatment or referrals, right? And ignore that part of you, which was probably more about the doctor than you anyway, right? So very good on you, I would say. Yeah, absolutely. She says, I knew something was wrong and she couldn't help me. How insightful, right?
I know, and I think we tend to revere physicians, so really hard to take what they're saying and to be able to compartmentalize and separate.
Yeah, I know. I just want to be like, yeah, thumbs up, thumbs up. Good method there. So yeah, this was it gets cut off a little bit, but I wonder if you could share a little bit of this diagram, like what this means.
Yeah, so the research showed that there were these 4 cyclical themes that emerged, the symptom experience being one of them. And what they meant by that was the actual experience of having symptoms. People found that because the symptoms are sometimes distractible or suppressible, it's very different than other neurological or physical conditions that are very physical. And people just don't understand that. The people are around people with F&D don't understand it, physicians don't understand it, and the person themselves don't understand it either. And it being really, really challenging to reconcile and to make sense out of. Also, many of the symptoms are invisible, or if you are able to suppress them, there's a period of time in which they're not visible to others, and how challenging that can be for people to understand. People really people really getting the sense of, are they making it up? Is it something that they can control? And the people with FND are perceiving this, and they're sensing it, and it just being such a stressful part of having FND. The other main theme, as you mentioned, was othering by the healthcare system. The healthcare system really treating people with FND completely different than other people with neurological or any type of health or condition, which is it's kind of unusual because in many health conditions, or at least in like psychological conditions like anxiety, there is like natural variability in symptoms. Maybe in some contexts we don't have anxiety, and in others that we do. But for whatever reason, in FND, it's just treated differently. And the just negative experiences that people having, and the negative attitudes and the biases that some healthcare professionals hold, just being really damaging. I've read in previous articles that a big part of that has to do with the experience of the person, which makes a lot of sense. So the people that don't have much experience with FND are more likely to hold these negative beliefs and biases.
Which is interesting because somebody commented here, I saw this, Eugene said, I saw a neurologist who claimed he was an FND specialist who said this.
Wow.
And I didn't go back. And I saw that come up in the comments, and it's just very disheartening because it might have taken you a while to get into a specialist. And then to have that experience makes me wonder about that specialty. But also that might even, make you feel even more at loss because you thought, gosh, this was somebody that was supposed to really understand this.
Yeah, definitely. And I mentioned earlier the path to diagnosis being so challenging, and that being a big part of it as well. Another main theme was related to just everyday interactions that people were having. People were saying, like, even though my family members are supportive, they just don't understand. And there's aspects of stigma that are coming from within the household, like family members getting frustrated and really feeling like maybe they're being lazy, or maybe they just don't want this enough. And so people are getting this stigma, this pressure from within their own homes as well. And lastly, the piece that's cut off is a really important piece, and that's how these experiences really accumulate and can be internalized over time. And that's something that I certainly see in my work with people that have had these experiences, is that at a certain point, it's natural for what we're seeing, what we're experiencing to be internalized. And many people start to hold potential ideas or parts of them that say, like, am I making this up? Like, is this in my control? Like, am I crazy? And that be adding this really extra level of suffering for people. Sorry, I didn't know if you had a question.
There's like so many comments coming in. Maybe we pause for a second, but those were kind of the big themes, right? Like the symptom experience, feeling othered by the healthcare system, having those everyday interactions, and then just that sense of self, which I have heard from so many people, the like shame that you start to feel, like, am I doing this to myself? And I just wanted to not miss these dreaming mirrors. That's really lovely. It can be hard because when you have physical symptoms, they can impact your mental health. And it is easy to be convinced that it's partially in your head because you're anxious because you're having like involuntary symptoms, right? Yep. Yeah, of course. And as Lauren and I are big believers in that there's actually only one brain and all of the components do interact, right? And so your physical affects your mental affects the physical, but it's not just one or the other, which is what I saw in another comment. Like Eugene said, he insisted I needed CBT only because it was a mental illness, right? And I think as a psychologist, you also like see that those messages come up, right?
Certainly. And after like working with this population, I cannot imagine treating someone with FND alone, because we have the good fortune of understanding the pathology of it and really understanding how it's such a complex diagnosis that influences so many different physical systems, and it really requiring many different people, not just a psychologist.
Yeah. There was also, I think, let's see, this was Sophie Charlie Izzy. I have been told by a psychologist that I use F&D as an avoidance strategy, implying I consciously bring on symptoms to avoid discomfort or imply helplessness. And that's certainly like, well, I'm curious. I'm not a psychologist, but that screams kind of a psychoanalytic maybe approach to symptoms. But I'm curious. Have you seen that description?
Not amongst like a well-informed clinician. I think that is really implying again that you have the power to turn these symptoms on and off, and it's something that you're consciously doing, which if you understand the neuropathology, that certainly is not the case. It's not a conscious decision to turn these on. And there are many other ways that you can avoid things as well. That would be a whole lot easier than having F&D.
Yes. Yeah. And Ethnicity Gardens, what insight you actually said for you found yourself doing that, and it was an unconscious response to people I didn't want to see, and you noticed it. And it sounds like maybe that was not the entirety of your understanding of your illness, but there was some part of it. And maybe then you learned something about yourself and said, maybe I need a boundary here or something like that. But I love that you said unconscious, because I think there's a very big difference between kind of like a behavioral like choice that maybe somebody's kind of blaming that on versus something that is really involuntary and out of your control.
Yeah, and the other piece I was thinking about with that comment is that is really the psychologist telling you what's happening to you rather than you like learning it for yourself, like ethnicity gardens.
Yeah.
Right. So like the process of really exploring these triggers, what contexts are these symptoms emerging in, is something that needs to be done in a collaborative fashion. It should never be something that is just told to you.
Yeah, and I mean, that just makes me want to cry, Lauren, because I feel like that is first, like kind of our whole entire mission at Re+active is to build a collaborative plan and understanding, like make sense of things together versus like you are doing this, right? Or labeling somebody, which is really part of the stigma. As Eugene shares, the difference from when I was seeking support for F&D versus seeking support for something like POTS or EDS was so huge. The stigma was so pervasive. I almost cried at how different it was. Yeah. And Eugene, I just want to tell you from the bottom of my heart, like first that I ache for you and that experience. And I've heard it again and again. And also, I think that's such a big like reason behind our like education and reaching out to other clinicians, because it shouldn't be any different than any other diagnosis.
Yeah, and the stigma with those conditions is also high. So the fact that you're seeing with F&D, it's even higher. I think it speaks a lot to just this experience that's unique to F&D.
Yeah, absolutely. So, and I also just want to say thank you for sharing that, because you're not alone in that. And I think it's actually probably really helpful for other people to hear your experience too. And as Sophie Charlie Izzy said, that's my point. It wasn't conscious and it was so invalidating. I totally understand that. And Eugene also said, I feel lucky I found a different neurologist who understood it a bit better.
Yeah, and this green box here in this picture refers to stages of knowledge, really showing that these processes are occurring in a cyclical manner, but throughout these different stages of development. And at a certain point, most people do report that they find healthcare clinicians that understand and validate them and give them like good information. But unfortunately, it's something that not a lot of people find early on, and it can be a long period of time also for healthcare professionals, like them going through stages of knowledge as well, in their journey of understanding.
Yeah. And you know what? I want to fully admit, I didn't know what this was when I first, right? Like,
Nope.
no, in school, I learned about things like conversion disorder or psychogenic. And it was a learning process for myself as a clinician. And I feel very lucky to have great mentors and a great team of that was very curious to learn this alongside of me. And I want to encourage folks too, that like when I was reading the stories in this article, Lauren, like almost everybody had gotten to some sort of stage where they were connected to somebody that got it and helped them. And I think that was really hopeful.
Yeah, certainly. There's a lot of misinformation online, but there's also some really great websites that have been developed, and society, the FND Society. So there's lots of change that has happened in FND communities, and being able to share this information with the world.
Yeah. And I wonder if we can talk, like, I think this is part of our own mission, is to continue to educate clinicians, mental health care providers that can be so helpful in this journey to understand FND and kind of counter the stigma. And I know the article talks about some ways that this can be done. I wonder if you could speak to that.
Yeah, and I think that's probably why I've loved this article so much. I think there's many wonderful stigma articles that have been published over the past few years that are really highlighting the patient's experience. It's just so important for our learning. But this article in particular really took that information and connected it to ways that we can treat people. And so they suggested that, based on their research, that validation is like an anti-stigma intervention. So just validating the person's experience, really equipping yourself with knowledge, of course, but validating the person's experience and really seeing them for who they are and trusting what they're saying is so important to counter stigma. So while stigma is highly prevalent, we can also counter it. So that was a really cool, like, kind of positive focus. Like, what can we do with this information and how can we use it to advance our understanding of treatment options?
Yeah, I think that's so great. And it's also exactly why we're doing a workshop next week. It's like, how do you do that? How do you do that as a clinician? What are some ways to center the experience and work with somebody with FND? And so if you're a clinician or a person with FND, by the way, we are purposefully doing the workshop for folks together, because we actually think when we come together and learn from the person with FND, we all get better. So we are doing a workshop next Wednesday, November 20th. It's 5 p.m. Pacific time. And it brings in some of this evidence. I was actually working on the slides and looking at Lauren's slides today, and they are so good. Like, the little nuggets in there are really going to transform your practice if you're a clinician. They are so good. I'm going to stop sharing here for just a moment because it makes it hard to see some of these comments, and so many great comments. I just want to say thank you for just really supporting one another here in the comments too, but for sharing too. This is a great question, Lauren. Question is, FND usually comes from trauma? Question mark, maybe. In other words, can you have FND without trauma?
Certainly, not every person with FND has trauma. PTSD and FND are different diagnoses. So not every person with PTSD goes on to develop FND. Otherwise, we'd have a lot more people with FND. In fact, most of us experience trauma throughout our lives. So probably we would all have FND if it was a close association. That being said, there is a higher chance of a person with FND having a history of trauma. So we do think that it is part of the process. It's possible that trauma, in particular during childhood years, or episodes of like neglect or challenges like regulating emotions in the context of like a safe household, can change the brain, and that might be a predisposing, some of those brain changes might be predisposing factors for FND. So just to summarize, they are dissociated, but people with FND have a higher histories of trauma than people without FND.
And I will say one of the histories of FND, and this is part of the stigma, is that it was only trauma. And since then, the science has shown us no. And it seems like there's a good 40% of people who have developed FND that have no history.
Right.
That's a pretty large chunk. And there is some detriment to kind of digging for trauma in folks where it doesn't exist, right? And that's part of where people with FND maybe haven't been served well. Vanessa is saying, I hate it when they say it's all stress as they don't know what it is. And people say, you look so well, but I know that I'm not well and have different symptoms. My worst one are my seizures.
Yeah, so descriptions like that showed up in that symptom experience part of the article. People really describing that exact same thing. People not understanding and saying, well, it must be stress. It must be on you. And just the challenge that comes when you might appear a certain way, but really be suffering internally.
Yeah. That the invisibility of some of that. And you're right. This is where, we hear from so many people that maybe we're told, well, you're just anxious. That's what these symptoms are from, or it's just stress. And we know stress affects every neurologic disorder. Like if you have Parkinson's and you're stressed, your symptoms are worse. Or if you have MS, or if you've had a stroke or a brain injury, your symptoms are worse with stress. But stress is not necessarily the underlying cause in FND. And the good news is that we are starting to understand there are other components, right? So stress might be one, autonomic nervous system regulation, which can be linked to stress, can be one, developmental differences, neurodivergent, hypermobility in the joints, all of these pieces might have some component of contributing to FND. We wrote an article about it actually just last month so that neurologists could actually screen for some of those things rather than, I think it was Eugene who said they just sent him to CBT and said it was a mental disorder, right? So that misses all of the other systems that might be involved. We just know better now, but we didn't know that. I will say we really didn't know that until we started. I'm not doing this research, but the world started doing the research, looking a little deeper at the brain and some of the parts of the brain that might be implicated.
Advances in neuroimaging certainly help as well.
Yeah. And ethnicity gardens, what kind of trauma do you mean? Mental or physical?
I think Ethnicity Gardens was responding to the prior message, but when we are conceptualizing our understanding of FND with people, we consider both of them. So it's really common for a physical injury to precipitate the development of these symptoms, or like emotional symptoms like a panic attack or episode of any physiological arousal. So these kinds of traumas, like these physical and mental stressors, play a role in many cases, but not all.
I love to share the story of Oliver Sacks, who had a physical trauma amidst a mental trauma, right? Of an accident that was really traumatic, and he developed FND symptoms in his leg from that. And this is a famous neurologist. But we do see, I think the statistic is about 20% is some sort of physical injury before FND. I hear you. I feel this way too sometimes. Sometimes I get overwhelmed on how much information is out there and to which ones I should take in. Everyone is so different and it's hard to figure which ones to read. I can't read them all.
And the article did a good job of highlighting this as well, with like the people really feeling like the onus is on them to learn and understand this stuff and then share it with their healthcare clinicians. And that being like really such a burden for people. Like not only do you have a significant life change and you're experiencing something really difficult, But then you're trying to learn all of this information as if you're an MD, and then communicating it with MDs. And that being, again, just really different than other neurological or any kind of health condition, and really points to like the importance of clinicians being the ones to learn the information and to find like the helpful pieces of information.
Yeah. And I just want to say, I find it hard. I get tons of articles, or if I'm on social media or Google, you'll see bizarre things sometimes, and I'll be like, what is that? And so even just deciphering, is this an evidence-based treatment or not, can be so hard to do, right? And this is one of the reasons, like, we have created so many resources and a newsletter with links and articles and evidence to help folks sort through. We've created a membership for people online where you can hang out with Lauren and our team and kind of help sift through so many of those messages that come all of our ways. Karen is saying, I firmly believe my dystonia. Doctors can't agree if it's FND or not, but the doctors seem to poo-poo the idea of trauma stress has anything to do with it. Well, that's really interesting. I think I hear the opposite more often, is that somebody gets dismissed and kind of says, well, it's just stress. But I will say I have had folks with FND or other symptoms say this all happened after a very traumatic event, right? And they are very certain it is entirely traumatic. And that's where it's really nice to have a healthcare team. I want to take that in. I want to understand what might be happening for that person. They might also have hypermobility. And maybe they had, so this is where it's on us as clinicians to screen these, right? So we want to kind of formulate this together, right? I almost think of like, let's put these things in a pot together and figure it out. You're suggesting that maybe stress is a really big part. And I might go, like we can look at your heart rate variability and other measures of stress and say, it's a big component. But as I'm seeing you move, I also see this. There is a sensory integration issue. There's hypermobility. There's dysautonomia. And we need to treat those too, along with the stress, right?
And there are positive features of functional dystonia. So there's a lot of good research that shows like how we can differentiate between those two, that movement disorder neurologists might be more aware of. Yeah, that's a very, very good point. That's like often my very first referral is a movement disorder neurologist. But again, they might not all agree, like you said, right? They might not all agree. And Sophie Charlie Izzy is saying, but you can't access needed care due to the stigma of FND. I had TBI after unconscious from fall, dismissed as psych because of assumption that FND means all symptoms are psychogenic. Yeah, and it is unfortunate how challenging it is to find someone that is truly a specialist. The FND Society and FND Hope both have portals with people that have more experience in FND, so they have their bios on there. I'm not sure where you live, but that might be worth looking at. And another reason why we've set up our membership and why we've set up like consultation services is so that, and these kinds of talks is so that we can educate people and help destigmatize this condition, help empower people to be able to work with people with FND in a holistic fashion. Yeah, and help folks that are having symptoms access good psychological care. So yes, Lauren works with other psychologists to mentor and consult with them on cases, right? But also get referrals to the appropriate rehab, to physical therapy, to occupational therapy, to speech therapy as well. Wow, there's so many comments here. Let's see. I missed one here.
Yeah, ethnicity gardens. I got F&D after a car accident. This is common, an F&D like post-concussion. That's what the brain doctor thought, and I used another doctor to get what I wanted. Yeah, you were very resourceful, I would say. I really did not have the traditional trauma you spoke of, and I'm very glad to hear that you can have F&D without that trauma, so it has been frustrating. Yeah, so some folks have a maybe outdated understanding of F&D, that you have to have that trauma, and if you don't, it can make you feel really lost, right? And absolutely, there's literature now that F&D symptoms might be more common in people with autism compared to people without, or people with hypermobility compared to without, and that's without trauma. So our understanding, our testing is better, is what I would say, so that we're seeing these other things that can cause brain changes. Trauma causes brain changes out of your control. Totally involuntary, but so do some of these other things. So what Charlie Izzy is saying, I had a concussion, but they wouldn't look at it. Despite having stitches on my head, as F&D, it means it must be all imagined, which is not true. And I hope, like many people in this article, I hope that you will also be able to find those providers. And there's a great group here. Kim Wilson is saying, I also had a TBI and then F&D. Doctor said that the concussion should be better after 3 months. So anything past that was functional, psychological, fake. Obviously that is incorrect, but we're going, yes, because we hear that a lot. And it's not true. It's absolutely not true. I should say it's not all psychological or fake. You might have developed a functional neurologic disorder after concussion. That can happen, but it's not fake and it's not psychological. Yeah. And what I should say, it's not entirely psychological. We're a one brain kind of person. Those psychological factors influence other factors and vice versa. We shouldn't be thinking of them as these separate entities, but integrated as a whole. Carrie is saying, well, thank you for this valuable information on what can contribute to F&D that's not necessarily trauma. This is good news and is helpful for me knowing it. Yeah. And Kim is saying, I'm lucky to find Re+active on Instagram early on, so I knew the doctors were wrong and my symptoms were not in my control and real. I'm glad you found us. And yes, I knew Ethnicity Garden is in Cleveland. We were chatting when I was in Cleveland, and has an excellent F&D program. And this is a great question too. Do you believe there's a cure? 100% no symptoms or setbacks. I got told to accept my new normal, but I want to prove the neurologist wrong one day. How do you respond to that, Lauren?
I think that's a difficult question. The research on outcome uses very different outcome measures, and some articles will show that treatment will completely get rid of symptoms in some cases. Others show that people are able to get control over their symptoms and live like a really full, high quality life. So I think it really depends, and we're a big part of what's helpful for people is getting a diagnosis early, and that's a really unfortunate circumstance that currently the average time to diagnosis is 6 to 7 years. So that's just a lot of time, and if we had good research on like what can we do if we're able to get a diagnosis immediately, I think that our research is really going to point to being able to make some changes, some like long-lasting changes, and really kind of pivot our understanding of recovery. But we certainly see every day that recovery is possible. It just might look a little different for each person. So we do try to stray away from like, let's try to get rid of symptoms 100%. Because that can put a lot of focus on the symptoms, and a big part of what drives symptoms is like the brain paying a lot of attention to the symptoms, and really moving over to like enhancing your quality of life and taking control of your symptoms, paradoxically, is what helps like you remove or get your symptoms down in intensity. So that's a really complicated question, and it was a short answer as I could give, but I could probably talk for an hour about that.
Maybe we need another live just on that topic. And wow, that comment, better in 3 months. As an SLP who has worked with patients with mild TBI, 3 months is an imaginary cutoff.
Very arbitrary.
It's very arbitrary, and they've really changed that understanding too. And thank you for taking the time to answer my question. Also, thank you for the great questions and comments. I think I actually have, I'm going to just scroll on my pictures here to share a picture with you if I can, because we are hosting this this workshop this week, and I was going to show it to you. Maybe here it is. Lauren and I, us two here, are going to do this together, and it's for mental health professionals and people with FND, making sense of it together. It's an online workshop. We will record it if you can't join us live. It's on Wednesday, November 20th at 5:00. By the way, we do have a little gift if you do join us live. So if you can make it, put it on your calendar. You can comment on our posts that we've been sharing about the workshop. If you comment FND, we'll send you the RSVP link, or just send me a message and I'll send it to you. I'm really excited about this topic. If you have a mental health care provider, that this would be a great resource for them as well. I think it is a way to shift some of our thinking and as a healthcare professional about how we approach and how we can really make a difference for people with FND.
Yeah, and we'll be focusing on breaking the stigma cycle in the workshop. So everything that you've learned today, we're going to be putting it into the workshop and really giving you some take-home points as to how you can either destigmatize yourself, or how you can how your healthcare professionals can help you in that journey as well.
Awesome. I love that. I'm going to destigmatize myself. We can't wait to see you, as Carrie says, eager for the workshop on November 20th. It's next Wednesday. You're welcome. He said, thank you so much. A great way to wind down and get some great info. You are so welcome. I'm so very lucky to be able to work alongside Lauren and our entire team, really. But to be able to give people good information based on evidence, and give some power back, power and control to you. So you are so welcome, and we will see you on Wednesday for our workshop. Bye.